everybody, Dr. Daniel here, and today I'm talking about exercise and migraine. All right, does exercise help migraine? Well, first let me define aerobic exercise. Aerobic exercise is Jane Fonda type aerobics: jogging, cycling, swimming, rowing, cross-country skiing, elliptical equipment, and stair-stepping. It is not walking in general, or lifting weights, or stretching, or yoga, or Pilates, or playing most games like tennis, golf, or racquetball. Fast walking may be classified as low-level aerobic exercise. Tennis, golf, and racquetball are too slow. The exercise is intermittent. Because of the running, soccer, and basketball would be considered aerobic exercise. If you're already exercising and still have bad headaches, consider increasing your exercise program. Exercise is something you can do for yourself to take control of your headaches, but it takes determination, time, and effort. So, multiple studies and literature reviews through the years have favored aerobic exercise as therapeutic for migraine. Exercise may decrease the frequency, duration, and intensity of migraine. Exercise for migraine, then, is like a drug, a very helpful drug. It's good for you, that reduces tension and promotes sleep. Some migraine patients get a workout headache if they get hot, and if this happens with exercise, then you should change to work out in a cool environment so you don't get so hot. Exercise in front of a fan or in air conditioning, to jog on a treadmill rather than running out in the hot July sun. Take ibuprofen, Excedrin, or half of a triptan only 2 days a week to avoid overtreating before you work out. If you still get a workout headache, then try a sport that doesn't raise the body temperature like swimming. A general rule regarding exercise is that if the migraine has already started, then exercise should be avoided. However, in some patients, migraine may be stopped by exercise. Aerobic exercise is also good for anxiety disorders, panic attacks, depression, tension-type headache, and sleep problems. There are many articles in the last 30 years on the value of aerobic exercise for migraine. Related questions. Well, I don't want to wind up in the CCU, that's coronary care unit. So aerobic exercise is good for reducing the risk of atherosclerosis. And atherosclerosis means hardening of the arteries, and it's a risk for heart disease and stroke. It means inside of the arteries are full of cholesterol. So patients who exercise get a double bonus. It helps your heart, and it also reduces migraine. Although migraine with ARA carries a slight 6% risk for stroke, migraine headaches don't usually kill anybody. However, the ravages of atherosclerosis are the main death entries on death warrants: myocardial infarction, or heart attack, and cerebral infarction, or stroke. The American Heart Association has warned that the number one cause of death over age 50 is heart attack. The number 3 cause of death is stroke. And that's important. And that's why the American Heart Association has suggested that a person's level of activity is one of the main risk factors for atherosclerosis. The other risk factors are genetics, overweight, cigarette smoking, elevated cholesterol. I'm talking about risk factors for atherosclerosis and diabetes. The American Heart Association has suggested that everyone exercise aerobically 20, 30 minutes, 3-4 days a week. Aerobic exercise is defined by the heart rate. There are different heart rates recommended by age to qualify for being aerobic exercise. And you have to do the exercise and obtain and keep the heart rate for the required time for the workout to be aerobic. Workout machines at health centers usually can calculate the required heart rate after obtaining the person's age. And you can get heart rate per age at the YMCA or exercise store, or even over the internet if you plug the data in. Also, several years ago, a Mayo Clinic cardiologist reported that, quote, sitting is the new smoking, end of quote, and said that even if someone is doing the 3 to 4 days aerobic exercise workout, is suggested if they sit all day long, then they have a risk of heart disease. Well, that's when I got a desk cycle for Amazon and put it under my desk at my office. How about basketball playing helping migraine? Is there literature on that? Well, Kennard, writing in 2002 at Headache on prevalence of migraines in NCAA Division I male and female basketball players, used the International Headache Society's criteria for migraine to determine the first prevalent study of migraine in college athletes. And so they mailed a validated headache survey to men and women in the Division of Basketball representing 51 colleges and universities. And the result was that 2.9% of the group was classified as having migraine. And the prevalence of the athletes was 0.9% in men and 4.4% in women. And it was found that the prevalence of migraines in NCAA division men's and women's basketball players was generally less than the general population, and that women showed an increased prevalence of migraines when compared with men, and that Caucasians and African Americans did not differ in the prevalence of migraines. So normally the prevalence of migraine is 6% in men, and they found 0.9%. And for women it is 25%, and they found 4.4% in basketball players. Well, what about the change in blood nitric acid level in migraine? Naran, writing in 2003 in Clinical Rehabilitation on the effects of exercise and exercise-related changes in blood nitric oxide level in migraine headache, studied 40 women with migraine attending a neurology clinic in Turkey. Comparing an exercise group undergoing aerobic exercise for 1 hour 3 times a week and a non-exercise group for 8 weeks, they found a decrease in pain relief and quality of life measures in the exercise group. Blood nitric oxide level rose in the exercise, but not in the control group. And he concluded that the study showed that regular long-term aerobic exercise reduced migraine pain severity, frequency, and duration, possibly due to increased nitric oxide production. Well, what about exercise and endorphin levels? Kosuglu, writing in Cephalgia in 2003 on aerobic exercise and plasma beta endorphin levels in patients with migrainous headache without aura, evaluated the effect of plasma beta endorphin level and exercise on migraine. They studied 40 patients with migraine without aura who exercised for 6 weeks on a treadmill, and they looked at pre- and post-exercise plasma beta endorphin levels, and he reported that exercise was found to have beneficial effects on all migraine parameters and to increase beta endorphin levels after the treadmill practice. So this study emphasizes the beneficial effect of exercise on migraine headache, especially in patients with lower basal beta endorphin levels. Well, does all the literature about migraine favor exercise? Not all the migraine literature is supportive of an ameliorating effect from exercise. Bush and Gall, writing in Cephalgia in 2003 on exercise and migraine, is there any evidence for efficacy? A critical review investigated whether recommendations of exercise for migraine are, quote, based on sufficient data to cope with requirements of an evidence-based modern migraine therapy, period, end of quotes. And they reviewed and discussed all the trials on 8 studies and 4 case reports, and they felt that some results were controversial regarding the efficacy of sports intervention in migraine. And they found that the majority of studies did not find a significant reduction of headache attacks or headache duration, but only indicated a reduction in pain intensity. So they concluded that to recommend further exercise and migraine-based criteria, more studies are imperative. Future studies should adhere to the rules for randomized clinical trials and pharmacological migraines prophylaxis implications for further studies are given. So they just didn't think the literature studies were done properly, and it didn't show the data. How about a training program for migraine patients? Darbinayu et al. Did just that and described their work for International Sports Medicine in 2011 on an article entitled Aerobic Exercise as a Therapy Option for Migraine, a pilot study. They studied 8 migraine patients with no special physical training and compared their results with 8 migraine patients who completed a 10-week aerobic running program, which consisted of 3 workouts per week, and they found the migraine patients of the exercise group showed both a reduction in the number of migraine days per month and intensity of attacks. What did the review of the literature on exercise and migraine reveal? Kosglu, writing in Sports Medicine Fitness in 2005 on the role of exercise in migraine treatment, studied scientific databases with keywords such as exercise and migraine. They found that patient population with low beta endorphin level in blood, high physical fitness, and high motivation receive significant benefits from the exercise treatment. The action of exercise on migraine is in general related to neurochemical factors, psychological states, and increase in cardiovascular and cerebral vascular fitness. Considering its effectiveness and minimal side effect, migraine patients should often be encouraged to practice physical exercise with intensity, frequency, and duration that should be carefully instituted to achieve the most beneficial outcome while preventing potential injuries and side effects. So in summary, you can read the data. Now all you migraine patients know what you have to do. Set aside some time, call your gym, get your water bottle and your shoes out, and let's go work out, because exercise in general is great for migraine. So this is the end of my talk on exercise and migraine. Please click on like and subscribe down there so we can follow each other. Please follow me on other podcasts I have on migraine. God bless all you folks with migraine, and I'll see you again on the next talk.